Hypertension, often called high blood pressure, is a common health concern affecting millions worldwide. It's like a stealthy thief in the night, silently damaging your body without you even realizing it. Imagine your arteries as a network of highways transporting vital blood throughout your body. Now picture these highways becoming narrower due to a buildup of plaque and pressure. This is essentially what happens in hypertension. Your heart has to work harder to pump blood through these constricted pathways, putting a strain on your entire circulatory system. The danger of hypertension lies in its asymptomatic nature. Many people don't experience any noticeable symptoms until significant damage has already occurred. This is why it's often referred to as the silent killer. Understanding hypertension is the first step towards prevention, timely diagnosis, and effective management. Hypertension is not a rare condition. It's a widespread health issue affecting a staggering number of people globally. Statistics paint a sobering picture of its prevalence. The World Health Organization estimates that nearly 1.3 billion people worldwide have hypertension. That's almost 1 in 3 adults. In the United States alone, about half of all adults have high blood pressure. These numbers are alarming, highlighting the urgent need for increased awareness and proactive measures to combat this silent threat. What's even more concerning is that many individuals remain undiagnosed and unaware of their condition. Early detection and management are crucial in preventing serious complications associated with hypertension. While the exact causes of hypertension can be complex and multifactorial, several key lifestyle factors play a significant role in its development. One of the primary culprits is our modern diet, often laden with salt, saturated fats, and processed foods. Excess sodium intake can lead to water retention, increasing blood volume and consequently, blood pressure. Similarly, a sedentary lifestyle with minimal physical activity contributes to weight gain and weakens the cardiovascular system. Stress, another hallmark of modern life, also takes its toll. When we're chronically stressed, our bodies release hormones like adrenaline and cortisol, which constrict blood vessels and elevate blood pressure. Understanding these lifestyle factors is crucial in adopting preventive measures and making healthier choices. Hypertension is often called the silent killer for a reason. It silently damages your body over time, often without any noticeable symptoms. Imagine a constant, relentless pressure on your arteries, like water hammering against a dam. This persistent pressure can weaken and damage the delicate inner lining of the arteries, making them more susceptible to plaque buildup. Over time, this can lead to atherosclerosis, a condition where arteries harden and narrow, restricting blood flow. The consequences of untreated hypertension can be devastating. It increases the risk of heart attack, stroke, heart failure, kidney disease, vision loss, and even dementia. The longer hypertension goes undiagnosed and untreated, the greater the risk of developing these serious health complications. Section 5. Diagnosing the silent killer, blood pressure and beyond. Diagnosing hypertension is relatively straightforward, but it requires being proactive about your health. The most common and essential test is a blood pressure reading. A healthcare professional will use a device called a sphygmomanometer to measure the pressure in your arteries. The reading consists of 2 numbers, systolic pressure, which is the top number, and diastolic pressure, the bottom number. Systolic pressure represents the pressure in your arteries when your heart beats, while diastolic pressure reflects the pressure between beats. A normal blood pressure reading is typically around 120 over 80 millimeters of mercury. A diagnosis of hypertension is made if your blood pressure consistently measures 140 over 90 millimeters of mercury or higher. In some cases, additional tests like an electrocardiogram, echocardiogram, or blood tests may be recommended to assess heart health and rule out other underlying conditions. Managing hypertension effectively often involves a multi-pronged approach that combines lifestyle modifications and, in many cases, medications. The goal is to lower blood pressure and reduce the risk of complications. Lifestyle changes are often the first line of defense and can significantly impact blood pressure control. Medications may be prescribed to further lower blood pressure and manage the condition. The specific treatment plan will vary depending on individual factors such as the severity of hypertension, overall health status, and other medical conditions. Working closely with your healthcare provider is essential in developing a personalized plan that addresses your unique needs and health goals. Lifestyle modifications are not just suggestions, they are powerful weapons in the fight against hypertension. Think of them as the foundation of your treatment plan. One of the most impactful changes you can make is adopting a heart-healthy diet. This means reducing your intake of sodium, saturated and trans fats, and cholesterol, while increasing your consumption of fruits, vegetables, whole grains, and lean protein sources. Regular physical activity is another crucial element. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could include brisk walking, swimming, cycling, or dancing. Managing stress through techniques like yoga, meditation, deep breathing exercises, or spending time in nature can also have a positive impact on blood pressure. While medications play a vital role in managing hypertension for many individuals, exploring complementary and alternative therapies can provide additional support. These therapies are not meant to replace conventional medical treatment, but rather to complement and enhance its effectiveness. Acupuncture, an ancient Chinese practice involving the insertion of thin needles into specific points on the body, has shown promise in reducing blood pressure. Similarly, biofeedback, a technique that helps you gain more awareness and control over your body's physiological responses, can be beneficial in managing stress and lowering blood pressure. Other alternative therapies like yoga, meditation, and Tai Chi can promote relaxation, reduce stress hormones, and improve overall cardiovascular health. Hypertension is a serious condition, but it doesn't have to control your life. By taking proactive steps to manage your blood pressure, you can significantly reduce your risk of complications and live a long, healthy life. Remember, managing hypertension is a marathon, not a sprint. It requires ongoing commitment and a holistic approach that addresses both your physical and mental well-being. By adopting a heart-healthy lifestyle, working closely with your healthcare provider, and staying informed about your condition, you can take charge of your health and live a fulfilling life, even with hypertension. In managing hypertension, medications often play a crucial role. There are several types of medications available, each working in different ways to help control your blood pressure. First, we have ACE inhibitors. These medications relax blood vessels by blocking the formation of a natural chemical that narrows blood vessels. They are effective, but can sometimes cause a persistent cough as a side effect. Next, beta blockers. These drugs work by slowing down your heart rate and reducing the force of your heartbeats, which lowers blood pressure. While effective, they might cause fatigue or cold hands and feet. Diuretics, often referred to as water pills, help your kidneys remove excess sodium and water from your body. This can lower blood pressure but may lead to increased urination and a potential drop in potassium levels. Calcium channel blockers are another option. These medications prevent calcium from entering the cells of your heart and blood vessel walls, resulting in lower blood pressure. They can be very effective, but some people might experience swelling in the ankles or constipation. It's essential to consult with your healthcare provider to determine the best treatment plan for you. They will consider your individual health needs, potential side effects, and how different medications might interact with each other. Remember, managing hypertension is a personalized journey, and what works for one person might not work for another. Stay informed, stay proactive, and always consult your healthcare provider to ensure you're on the best path for your health. Subscribe and like for more videos.